call on diagnostics, and I'm very pleased to have Dr. Jeoff Drobot from ACBM out in Arizona and the BioMed Center in New England joining us today to speak more about this. I'm going to not waste any time and turning it over. However, I should say, if you're not already on mute, we would appreciate you taking a moment just to mute yourself. And if you have any questions that come up along the way, please go ahead and you can add those to the chat box, and we will come back to them later on in our presentation. One last note is to please be advised that this event is recorded. And so if you do not wish to have your face in that recording, you can go ahead and just turn your camera off at this time. All right, with no further ado, Dr. Drobot.
Good morning, everybody. Thank you for, geez, I guess it's really sunny in Arizona. I'm not sure what it would be like over where you guys are, but in any event, we might as well just roll the tape and get right into it. So everybody asks the question, where do I start in my healthcare journey? You know, whether I'm sick or whether I'm well. I mean, there always has to be an introductory point, and it shouldn't necessarily be your diagnosis. That's a terrible entry point, because usually it means that enough time has eclipsed or enough time has gone by that we finally enter in something that we really didn't sign up for. And so today we're going to speak about how do I get this roadmap of what not to do, because the diagnosis will tell us what it is, and it'll tell us when it happened, because we'll get the diagnosis, but it won't tell us how, and it won't tell us why. And so I want to show you how we use technology at our centers, namely the BioMed Center and ACBM in Arizona, so that we can understand why I would go ahead and get more assessments than just, we'll say, a yearly physical. And when we're coming back to the yearly physical, we have to understand that there's 364 days. And most people are quite, as we get a little older, we're quite diligent about maybe checking in once a year, but oftentimes, I mean, we've let our 30s go to our 40s and our 40s go to our 50s, and unless we've had babies, oftentimes we spend very little time in a doctor's office, only because a lot of times we don't garnish value out of the information that we're told. And when we're looking at health, we should think of it as almost like a mechanic. We should drive our car in once a year or once every 6 months, and we should pop the hood. We should look under the hood, and we should kind of do a systems check to see which of those systems might not be performing like they should, or maybe they're wearing out a little bit before they actually break and we have a more expensive fix down the line. So how we do that is we combine unique assessment tools with conventional assessment tools, such as blood work. We probably just do a little more blood work than your standard blood work panel. I still like sometimes x-rays, bone densities, MRIs if we need them. But again, those are, I'm going to say, pathological or lesional tests. We oftentimes don't see anything in images until something actually appears. And for example, if we take a coronary artery, that can take 40 years before it's 90% blocked. For a tumor, that can take 30 years before we finally get to see a tumor on any kind of imaging. So we want to look and we want to understand, like, how do we measure the process? You know, how can we actually look at the process and say, what is going on under the surface of the water, so that we prevent these things from occurring? Because everybody preaches about how health is supposed to be proactive, but oftentimes we don't have any qualitative data to measure that. We don't know from one year to the next if I'm diagnosis free or if I'm feeling good. What actually is going on in that year? What should I be careful of, or what should I be proactive with, or how should I exercise, or how should I eat, or what should I be exposed to? And I want to show you just a little snapshot on the measurables on this, because in, we'll say, bioregulatory medicine, the whole thing is to look at systems. So we look at digestive systems, nervous systems, hormone systems, immune systems, cardiovascular systems, lymphatic systems. And each of these systems plays a certain note, and then the notes go in to make a certain song. And whether you're good at playing the song or you're terrible at playing the song, that is the product that your body is going to give off. And oftentimes you can understand that those systems are trying to play in harmony. And when one is off tune, oftentimes then we're going to get some issues down the line. So let's roll through some of these because some of them will be new. And even though the words look fancy, I mean, the technology and the science is pretty sound. So there's ways for us to look, and I do encourage every single one of you, and some of you might not have some of these in your area, but start to understand that there's things that you should be looking at as far as your health that you're obviously not doing now. And there's a proactive nature that you want to take as far as medicine goes, or as far as your health goes, because it's not either you're healthy or you're sick. I mean, there's always gradients to that. And the whole goal is not to have to spend 24 hours a day on your health because you have to. The goal is to understand where to put your energy so you don't have to down the line. So let's roll through some of this. Okay, that doesn't work. So how are these assessments different? As I mentioned, oftentimes we go to physicians, me being one of them, and we say, well, what's gone on this year? And you just kind of give your 30-second spiel about how you're still feeling healthy. And that's pretty much it. You might have some digestive complaints, you might have some chest pain, you might have a sore big toe. And then they're going to basically do those assessments on that part, if they do, on the part that you were able to communicate that might have been a problem. If I'm having digestive complaints, okay, let's do a colonoscopy. Let's see if there's anything. And 9 times out of 10, thank goodness, there'll be nothing there. And you'll say, well, I still have the problem. And they'll say, well, you don't have that problem. And so that leaves you then with years and years and years of finally working towards your final goal of being able to see on some kind of diagnostic test that you indeed did have a problem. And that is not the route that we want to go. That is not our goal, to work towards a diagnosis and to be able to say on our blood work, I told you so. Our goal is to look at these assessments and say, conventional assessments will again tell you what it is, right? We'll look at blood work. It's a very small part of the body. We'll look at imaging. We can only see what's there. And then we might be able to tell you what you have. We won't tell you again the process. And so how our bioregulatory assessments are different is we want to look at how is it happening? Why is it happening? Those will be the big pieces, because unless we have an acute injury, there was a process behind our diagnosis. Maybe it's a tick bite, maybe it's gluten, maybe it's some mental emotional stress, but there's always a repetitive process that leads to a product. So we want to find out, how are we going to look at the product? In order to look at the final product, we need to see the actual departments that go into making the product. Because IBS is not necessarily just a digestive disease. Hypothyroid is not necessarily just a thyroid disease. Fatigue encompasses everything. Insomnia encompasses everything. Lyme disease touches so many different systems of the body that we want to look at each of these systems, and maybe what we think we're treating is actually holding up okay, and we should be backfilling some of these bigger systems down the road. So the first thing we're going to look at, which is one of my favorites, is how do we test the nervous system? So these nervous systems are big electrical units. Our body and our central nervous system, namely our brain, is giving our body input all the time. Our body is recording back to our brain, and it's either saying one of two things: we're safe or we're not. There's 2 nervous systems in that category. One is called the sympathetic nervous system, which is your basically fight or flight. And the other is a parasympathetic nervous system, which is a rest, digest, and repair. Now, I know all of us want to be lifelong yogis and be in this sedated state of rest, digest, and repair, and that is pathological as well. We want to have some grit. We want to have some times in our body where our body is actually under some stress, whether that's with exercise, whether that's with mental strain, whether that's with an immune variant that our immune system needs to get stressed to react to it. Oftentimes we're too tired to react to those things, and so these infections take hold of our body. So we want to have a balance between those two. We do not have a test in conventional medicine that does this. When we talk about neurology, basically what we're talking about is MRIs to look at things like multiple sclerosis, or we're looking at nerve function tests, which again, we have to be pretty down the road for those to elicit an abnormal response. So I want to see, how is that person's nervous system responding to day-to-day life? Is the balance okay? Is the ability of that nervous system, which is like your battery in your body, so you can understand that your battery is supposed to put off charge, and I want to have a certain amount of charge. That's the whole reason I'm doing this, is because I want to be able to rest my body, recharge at night. Then I want to use my battery during the day to do various activities, digest food, fend off invaders. And I want to have that set at the end of the day to some kind of balance where I can repeat that battery, plug it into the charger, and I know it's going to go for the next 110 years. That's what I'm looking for. And so we need to be able to quantify that to measure it. So even though we always look at heart rates and we say, my heart rate is 62 beats a minute, we have to understand that there's no beat in that minute that's going to be the same from time to time. So the best battery is the one that can kind of do the most amount of work. It's going to vacillate. It's going to be a constant radar. It's going to say, are we here? Are we here? And it's going to constantly survey our environment. And the bigger amount of range or the biggest amount of variability, the better our battery is. The tighter or the less amount of variability, again, the more that our body can't play that symphony and it can only play one note, we start getting in trouble, because it's like this little dog that just sits here and shakes, and it can't fend off anything. It can't eat, it can't sleep. It just sits there and shakes. And when it does that, unfortunately, there are other systems that are breaking down, because our first system that we are born with is our nervous system. We pop out, we cry, we figure out if the environment is safe. And the last nervous system that will the last system that'll shut down in our body at the end of it all is your nervous system that says, the battery is finally done. So we want to have lots of variability in the time, since I mute this. I was muted for a second. I don't know if that was intentional or somebody didn't like what I was saying, but we shall carry on. So I don't know if that was the hook that comes in from the side and they're like, you're out of here. So
Yeah. Enough about death, Dr. Drobot.
Oh yeah, no, nobody wants to talk about mortality.
Yeah,
there we go. So how do we do this? Very simple testing. Again, a lot of this stuff is non-invasive. So when people come to a clinic, nobody likes to go to a doctor because they say, is it going to hurt? And that used to be the hardest job for dentists, to try to make things not hurt. But I want to promise that most of this stuff doesn't require needles. Most of this stuff doesn't require invasive situations to actually look at our system and see what it's doing. This is about as invasive as it gets. Your nervous system is always giving off sound. We need a way to measure that sound. So there's computer programs that are lovely. You basically put a chest strap on your body, similar to what you would do at the gym, and it's going to pick up frequencies, and it's going to put you through a variety of situations, such as laying down to standing up, and it's going to look and again see how that nervous system is responding to stress. A lot of our conventional testing, again, only is 1.1 time testing, which is why we all do our fasting morning blood work, because everybody just wants 1 point so we can assess it to norms. That is not the way that your body is going to function during the day. So we always want to put a body under some work so we can see how it responds to the certain environment. It's a more valuable test. So this is it. I lay down, I stand up, we let it cook for about 5 minutes, and we get these wonderful graphs. Now, what do these graphs tell us? Again, they tell your practitioner how your nervous system is going to respond to the environment. Can it respond to the environment? With what can it respond to the environment? And what is the balance of this nervous system that is responding to the environment? So I hate the word stress because it doesn't mean anything. Everybody says I'm under stress. And does that mean that it's too hot, or does that mean it doesn't have enough power so that you're irritated all the time? There's a big variation between those two. So we want to be able to quantify that, so I can say, indeed, Katie Mannix, your husband's driving you crazy. Let's get out of this situation, or whatever we're going to do. We have to look at those situations and say, how much charge does the battery have, and what balance is the battery in? Then I can tell you, is meditation better than jogging, right? Sometimes in order to get rid of some stuff, we need to jog. Sometimes in order to recharge some stuff, we need to meditate. And oftentimes when we're looking at these, people will say, that's why I'm no good at meditation. And I'll say, you should probably not do that, because you're putting your body in a more stressed state to try to get it to do something that it's trying to avoid. And again, once the graphs and pictures are power, now we'll say, we have something. Next year, we'll look at something else. Or if we're working on getting rid of a health problem, we'll say, here's what we need to work on. Now we actually have a plan. So we can say, let's put these 3 things in play, or even better, let's take these 3 things out of play. And let's see how this nervous system responds, because there's no sense in us waiting 6 months, doing a bunch of treatment, popping a bunch of supplements, eating absolutely nothing but air. And then at the end of it, we're like, we're not really that much better. And then we have to figure out, like, what did we do in that whole process? Were we actually working towards a goal, or were we just putting our body in a different state that it couldn't accommodate to? We got the nervous system done. Now we want to have some way to look at the space in your body. So there's hundreds of trillions of cells. And again, in conventional medicine, we have no way to look at those cells. We just assume that they're okay because we look at the bloodstream, but the bloodstream isn't cells, even though we measure white blood cells and red blood cells. We want to then see if this battery of the nervous system is charging up, how does it affect these cells? Because these cells are the actual generators of energy. I need to make sure I got wiring to the cells. I need to make sure the cells then can produce some energy. We do this with a little thing called bioimpedance analysis. So bioimpedance analysis is going to measure different compartments in your body. There's going to measure cells and then a bunch of space. You don't have a whole bunch of cells in your body, even though I say hundreds of trillions, but we got a lot more space. And so we want to see in that space, what is happening in that space and what kind of charge do we have on the cells? And the best way we can do that is bioimpedance analysis. A lot of people might have heard of bioimpedance analysis from the fitness facilities, which measure lean body mass and fat mass. And it's very important for doing that. I'm sure it's heads and tails above anything else that can measure that. But I'm always more interested in what's happening in the space. Do we drink enough water? Is it hydrated? Do the cells have charge? Or do we have a problem with detoxification? Can the cells not get rid of that stuff? So it's more important that we're looking at the space. Again, this test is very simple. Looks menacing, but what it is, it's an electrical test. You don't feel the charge. It sends dilute charges. And when things don't flow well, it's going to come back to the machine and it's going to measure resistance. So we're looking at, again, you can see overall cellular health, inflammation, hydration. We're looking at these things that, again, we cannot measure with conventional medicine. Really easy. 2 electrodes on the hands, 2 electrodes on the feet. We're looking for different frequencies, and we're seeing how much charge does the body elicit. So I know the nervous system, again, I have that compartmentalized into either gas pedals, which are stress, brake pedals, which are relaxation. And I want to see how much or what kind of soup is this electricity flowing through? So really simple, easy testing. What do I learn from this? Again, I learned the charge of the cell. As we get older, unfortunately, regardless of what we do, cells lose charge. The whole reason we exercise is we try to increase charge in our body. Our muscles are like rechargeable batteries. We're trying to add electricity into these cells, and the cells have to have good cell membranes. That's why we take omega-3 fatty acids, and we want to measure the cells. In illness, it's very predictable. We can see electricity drops in the body, cells become less adept at holding charge, and overall areas can't protect themselves, which means other things happen to cells that we don't want. So we want to take this information because we can always use wonderful bioregulatory treatments, such as electron treatments that hook up like battery charge, and we can recharge the body so that if we come in a lower or electrical state and we have some kind of condition, we want to have lots of energy in our body so that we can stimulate immune systems, we can stimulate nervous systems, we can regrow tissue faster than we can, and we basically take a little step back so that we can recover as we used to do when we were young. Is it the fountain of youth? Electricity is pretty close because the whole body is with physics, as most of us know now. And as long as we can measure charge, we can change charge. And that's probably one of the most important ways to measure cellular systems. Now we have to look a little bit deeper into the nervous system and see what organs might be coming back that are more irritated than others. And that's hard to assess if we don't use electrical energetic testing, because we're having the central computer, which is our brain, and we're wanting to then do a systems check, like I said with that mechanic, and we're wanting to see which organ systems have issues and which don't. Very easy to do. Almost like a lie detector, we're measuring skin resistivity. What the computer is going to do is it's going to ask your body or introduce a lot of different frequencies to your body, kind of like that polygraphist asking you a bunch of different questions, and they're going to look for stress responses based on skin resistivity. A lot of this bioenergetic testing has gone down the path of witches and wizardry, and we want to bring a little bit of science back in, saying, you know, we want to have actual things that we're testing. We want to measure actual illicit responses from the body. And this has gotten a little crazy, which drives conventional medicine nuts. But there is a lot of good science to this. Back in the day when I started, and a lot of people might be familiar with some of this, muscle testing works on the same philosophy. EAV or Vega testing works on the same philosophy. We used to introduce vials into the body's electrical field, and we used to look at the nervous system's response to that, and whether the muscle went weak or whether it stayed strong, or whether the dial had a reading or whether it didn't have any reaction. Now with computerized testing, we can make some of this a little quicker than it used to be. So all it is message comes in, song plays for your body either doesn't react to the song, which doesn't mean good or bad, just means it's not a reaction, or else, just like a question from a lie detector, the question is a little stressful, then we record it. Still up to the practitioner to understand what's happening with that information. Every organ has its own little phone number. That's the way it can communicate with your central nervous system, with your brain, which is your brain. Your lung has a little phone number. Your pancreas has a phone number. Your parathyroid. We're going to go ahead and dial that number. If somebody picks up, no problem, doesn't record on the machine. If somebody doesn't pick up and there's resistance or static on the line, it's going to record as something that's stressed, which we'll call a disorder. Again, that doesn't mean it's necessarily diseased and we got to remove it. It just means that particular organ is trying to communicate with the nervous system saying, can somebody please help me out? I'm under a little more work than I need to. We want to go ahead and look at that. Now we have something where we can actually have little priority lists where we say, hey, on this particular example, you know, that was interesting. That thyroid, which I thought was the problem, doesn't seem to be under that much stress, but up the food chain, the pituitary gland seems to have a little bit of stress. Oftentimes, when we correct what we can actually see, the organs down the line are the ones that we thought were under stress, are actually just responding to what wasn't right or what the environment wasn't doing to put it in a place of function. Let's review. Now we just had a bunch of electrical tests. We looked at the central nervous system, which is our computer. We looked at the peripheral nervous system, so we looked at the electrical systems. We then looked at the cells and saw if the cell could produce electricity. Is the wiring good? Is the cell good? Then we looked and we went a little bit more into that computer program, had a little bit of an idea in saying which one of these little organs has their beak wide open and is looking for a little bit more love from the mother. And then we're going to come back to it because we have to look at some more space, which is going to measure how are these individual organs, and most importantly, how is our mouth, how is our lymphatic system, how are some of these other organs adapting to the environment. And to do that, we need, again, point testing, non-invasive. What we're doing is we understand that heat is related to nervous systems, which is related to organ systems. So the whole reason we do acupuncture is because we use skin reflexes to affect organs deeper in the body. So this is we'll say the whole idea behind acupuncture is that we can use skin. Our body has to have ways of communicating with the environment. So we have liver points and lung points and teeth points and pancreatic points and small intestine points. And we want to have a way that we can measure it. And again, if the organ is normal, it responds normally. If the organ is abnormal or disordered, it's going to respond a little bit differently. So in order to do that, we need very sensitive devices that we can measure these points on the body. And that is called thermography. We use either something called a computerized regulation thermography, or we use AlphaSite. These are two different machines that work beautifully. AlphaSite's much newer, gives us better imaging or graphing. And we can look at the autonomic nervous system's response to a bunch of this. Now, what can we see in this? Absolutely everything. If we didn't have anything else but thermograms, we can at least take a global look at most parts of the body, including the jaw, which is important. You can see 119 points we're going to test. We do it at rest. Then we put your body under certain stress, which is cooling. And then we want to remeasure how all those bodies reacted to the stress. So most of the time, bodies are supposed to cool. Some of the parts of the body are supposed to heat up. The whole head is supposed to heat up. The whole body is supposed to cool down, but it's only supposed to do so in a very minor amount, which is measured with temperatures. So how do we look at this? Then we get these graphs. I like to look at each individual organ. The graphs are nice presentation pieces for you guys. And it says, what is not functioning in the body the way that it's supposed to on the basis of heat and stress? So we can look at sinuses, teeth, thyroids, small intestines, large intestines, and most importantly, we can look at the global system, namely the lymphatic system, and we can say, does that person have the ability to detox or do they not? Is that person to intox, to detox? And if we do detox them, will we cause them more issues than not? So we combine that. So now we have lots of different ways. Now we have nervous systems that look at organ systems, that look at cellular systems. Now we're going to start to look at a few of these other things, including heavy metals, which can affect some of these lymphatic systems. And this it'll scan because I put this on there because a lot of people are concerned about toxicity. So Alligo scans, which are a little device from Europe, is a wonderful way to non-invasively measure heavy metals. Why is that important? Heavy metals are heavy, which means they're almost one of the toughest things to eliminate when we're talking about detoxification in the body. They're endemic in the environment. They have a very detrimental effect on organ systems because they sit there for a long period of time and irritate. Gluten is there only for a day or two. Mercury is there for hundreds of years if we don't go and actively eliminate it. So we always want to have a way to look at body burden. With the tests that I showed you, the assessments, I can tell you how the body is responding, but I can't tell you the body burden. And it's hard because people say, how many heavy metals do I have? Or how much chemical do I have in my body? And that is very, very difficult for us to quantify because the body is so vast in space, but we can measure with, we'll say, skin levels, and we can measure with chromatography. We can look and see, well, if these things are in the skin, then we can deduce that they're also in the body. Very simple test again, very innovative technology. Measures skin. It's looking for refractory period or refractory indexes of certain minerals and metals in the body. Everything has its own composition. And it's going to give us some nice graphing again. Why do I like these tests? Because if we don't do anything about these metals, it's not like foods. We don't do anything about these, they're very hard to clear out of the system. We're all worried about knowing our names by the time we're 90. That has become a real issue when we're talking about the words Alzheimer's, dementia. Everything's scary as we get older. The brain is a bunch of fat. Nothing is supposed to get in the brain. Heavy metals are a problem because they actually accumulate in fatty tissue, namely being the brain. So we want to look at these and we want to say, I'm exposed to water, I eat fish, jets are flying over my head, I've had chemotherapy. I need to know what my body burden is because I'm not afraid of it, but I want to work on it so that I can do wonderful things so I can make sure that I constantly keep the garbage can half full. You're never going to keep it empty, but you want to keep it half full so that it doesn't sit there and do insidious irritation, which again affects our nervous system because our nervous system, remember what I said, we start with it, we end with it. We want to make sure that we have healthy nervous systems and healthy cognition into our elder years, as we call it. So I'm going to now put these all together, and then I'm going to take a host of questions. We do not only do these assessments on your visit. We combine these assessments with other things that we'd like to see, such as blood work. I Myself, like to see a bunch additional blood work more than basic blood panels. I like to see hormones. I like to see cardiovascular panels, but we have to understand again, that's a moment in time, 1-point testing, not under stress. So I combine what you bring to me, which is images and blood work, or I might order some, and I combine that with, we'll say, assessment or active movement testing, so that we can see the result and we can see the process, and we put those all together. And again, your history is also layered into that. What you say is what you know your body better than I do. And when I show you now these pieces of information, we have a much different conversation, because you say, you know what? When I was little, I used to have lots of throat infections. And I'll say, here's what we're looking at. Now we can piece these things together, and we actually have a beautiful health picture. We have a very active and dynamic flowing health system, so that we can sit across from each other. My patients are very well educated. By the time we're done in an hour, they can come in not knowing anything. And in the end, we've now gone through a bunch of different biology and a bunch of different physiology, and we've come to the conclusions of what on our hit list do we really need to concentrate on. And not only from a disease perspective, but from a longevity perspective. We can see where some holes in the bucket are. And then we have our plan, because our plan is not to wait for 364 days. That's not a healthcare plan to me. Our plan is not to keep taking 15 medications or 30 supplements. It's not a plan to me. It's like, we have to have plans. We have to have things that we're looking at year to year to say, let's go ahead and put a little bit of time into this system because it's lagging behind the others. And let's give that a little TLC so that we can prop that thing up, so that in the end, you remember, we're driving one body with lots of systems in it, and we want to ensure that no man gets left behind. So if we have all of these quantitative data, and we're looking at these things maybe 6 months, sometimes once a year, we have a really good health record. First year is just an examination. Second year, we start to get good amounts of information, so we can say, hey, you know, that lymphatic system still isn't moving like it should. That might just be, when we say genetics in medicine, that might be genetically a little bit of a weaker system for you. So let's pay extra focus to that. And that's pretty much the way that we put together our health assessments, because then we have to put together a treatment plan, and it's impossible to get a good treatment plan if you don't know the processes and the systems, in my opinion, that need it the most. I'm not always worried about what you think is the biggest issue. I'm worried about the process that led to the issue. And that leads us to a little bit of a different medicine. And that's really all I got to flap my gums on about physiology. So I'll take any questions that you may have.
All right. Well,
34 minutes. I said that was going to be 25 minutes. 30.
I think it was 15, to be honest, but you know.
I started with 15.
But I did mute you, so I had to give you back some time.
Very good. Ruined my flow.
No talking about death. All right. Well, we have plenty of questions. So as my colleague Patty noted, again, I'm Katie Mannix, BioMed Program Coordinator here at the Marion Institute. If you have questions, please go ahead and put them in a direct comment to Patty or myself, or you can place them in the chat box and we'll get to them as best we can. But one of the things that's kind of come up already, and I think it's worth talking about, is assuming that most of the people on this call, Jeff, haven't already had these tests, and maybe this is kind of, you know, like drinking from a fire hose a lot about these things. Can you just walk us through your recommendation for, all right, your interest is peaked. What do you do next? You know, who do you get in touch with? What are we scheduling? What are we doing?
Yeah, I don't, as I mentioned, I don't think anybody wants to know anything about these tests until you sit in front of the tests. You know, it's simple, like it's an education. You know, in order to go and actually sit and look at your testing, you don't need to know anything about something. You just have to have an interest to maybe go and learn something. And it's crazy to me because I always want to know something about, especially if it's your body. And I've never had a patient that left saying, I don't care about that. It's like, even if it looks like it's complicated, the first process is always scary. You know, when you do anything for the first time, you're taking a certain leap of faith. But the whole point is to gather information and to then work out a plan. And the plan is not supposed to be scary. You know, the information is to allow us to do intelligent things. It's not supposed to allow us to do everything. So you got to find some place that has some of this equipment. At the Marion Institute, there's a BioMed network. The BioMed network usually has practitioners that Katie can kind of flip to you guys later that have some of these pieces of equipment. Might they have it all? Probably not. There's 2 centers that I know that do because I frequent them. One is my center in Scottsdale. The other one is the BioMed Center in Providence, Rhode Island. I would travel for these assessments because, again, I say it's once a year. Once in a year, you want to go ahead and get a real good health assessment so that you know we can take it back to our local practitioners, maybe our acupuncturist, maybe our nutritionist, maybe our functional medicine doctor. And you want to be able to have your health file. There's no more important person that has your health information than you. You know, it should be a file in your computer like your taxes. You should have it there. And the more that you have it and the more that you look at it, the more you understand it. It's not, the language isn't going to change and it's not overly complicated. So once a year, we want to sit down in one of these centers and we want to actually have an up and down go through and a great conversation so that we can check the boxes and say, all right, now I know what I need to work on. Then we can take that locally, or a lot of people have information by themselves and they can say, all right, this is what I'm going to do to move these numbers.
And I will say, you know, my colleague Patty just posted a link in the chat box with a direct link to our BioMed network, which Dr. Drobot referenced. You can find some information there on people who practice different forms kind of under the umbrella of biological medicine and might have these tests. A common one, and we wrote about it for Women's Health Month in March, is thermography. It's one that Dr. Drobot just presented on as well, the 119 points, you know, under stress, which is just cold. It's not like you have to go run a mile. And I will say that as I myself have tried that out as a woman. It's great because it gives a little bit more insight into breast health as kind of a pre-mammogram, you know, without the exposure to radiation. And that one you can often Google, and I see it popping up more, and I see more people kind of writing about the benefits of a thermogram. And so I'd say that if this interests you, that's definitely something you might even be able to get away with a Google search on and find someone wherever you are.
And things like thermograms, I mean, none of these things need to replace conventional medicine, but you have to understand a mammography isn't going to tell you about breast health. A mammography is just going to tell you whether you're a breast cancer or not. It's more important that you look at the environment that the breast is living in. And that is the lymphatics, that is the circulation, that's breast health. Mammographies only look for pathology. Sorry, stick on my throat.
No problem. I did have a related question as we're kind of on this topic. I had an individual write in asking about how you diagnose lymphatic problems.
Well, wow. You use the thermogram and you use BIAs. And you look at the environment that the lymphatics are in. So everybody has some kind of lymphatic congestion. But in order to actually have real time, you have to quantify the lymphatics to see, are they flowing or they're not? You know, are they trapped in the head or are they trapped in the body? So thermograms are by far the best way to look at that.
Yep. And then I've got, you know, people asking as well about, again, we kind of come back to the topic of payment, and that is a real question, but I think, you know, will companies pay for these tests? Will they pay for the follow-up care? I'll let you speak to that because I know that. So
I have seen insurance companies and health spending plans pay for it because it's an hour. It might be, it's $1,000, you know, for most of the tests. And so it's, again, once a year to spend $1,000 on yourself is a no-brainer. You know, like when we look at MRIs or things that are $800, I mean, you're almost already there. So health spending accounts will do it. It's different. I'm Canadian, so I still don't understand American insurance, but we definitely have people that have had, especially thermographies. I mean, even to start with a thermogram in your area, and some people do picture thermography. Again, breast thermography for me is like one moment of the body, like the breast tissue, like you want to make sure that you do full body anything. If I'm going to spend money on assessments, because looking at local things is fun. That's a whole reason why we do biological dentistry, is because like the teeth are in the body. So we kind of have to look at how the teeth affect the body. But if you go ahead and do full body thermographies, I think you'll be surprised that insurance can cover that. And that's even a wonderful place to jump in, because you get lymphatics and you get to see how blood flow is going to different organs. So insurance, you'd be surprised, but you gotta tussle with your insurance company a little bit. But I've seen the possibilities.
Yeah, and just to speak really pragmatically, there's a question here about what does it cost for a first comprehensive visit to Scottsdale and the time needed, same kind of Providence. You can call the BioMed Center, the ACBM in Arizona, and request a price list from them. I know that they have that available and are able to provide that to you. But again, as someone who, is kind of coming to this new myself, some of these tests are more reasonable, again, and thinking about the benefit that you'll reap in the long term, and taking care of some things maybe you wouldn't have without having the information. I think thermography, if that's the only test you're going for, I think, you might find it in the range of $200 to $300.
That's it. Like I said, I think with a consult, it's under $1,000. And to do that for once a year, I mean, you add up your dining budget over 6 months. It's like, there's no comparison. It's expensive paying for disease later. I mean, we're talking about tens of thousands, hundreds of thousands of dollars. So to spend, you should put some investment into your health before you have to pay for disease, because boy, is it expensive, especially as you get older.
The question about timelines, how long, I guess, are any of these tests, how long does it take to conduct them? What's the time? Yeah.
So normally, I mean, I have a lot of people just fly in for one day, because the funny thing with the thermography is you got to show up, no showering, no brushing your teeth. So you got to be greasy, because we don't want you to heat your body up. That's the whole purpose. We want to see everything at rest. So you'll show up, the thermography takes an hour. The rest of the testing might take combined another hour. So you're really into it for 3 hours. And then you have your consult, because we let you go and get something to eat because you're starving and you want to brush your teeth and you want to look at least somewhat put together. And so 4 hours, we're in and out of that. And you have now a whole bunch of health information that you're leaving that you're going to be active on. So no, it's not. It's like I said, it's not very invasive, and the timing isn't that great, and the cost isn't a deterrent. So I mean, I always think they're no-brainers. After somebody gets it done, I never have had somebody who's like, what a waste of time. I've never had, in my 20 years, never had somebody say that.
I guess another question too, and it's kind of come up before, which is, probably a lot of people on this call maybe have a primary care physician, someone that they're affiliated with who's a conventional practitioner. Right. Is it, can people in their conventional practices introduce these technologies? Is that something they can do, or must you go to a naturopathic clinic, biological medicine center, to be able to access these tests?
So any physician can do anything they want to as far as assessment tests. Now, the unfortunate thing is, do they bring them in? No, because again, most of conventional medicine is based on heads in the beds, which is 5-minute consults. So it's very difficult. I have lots of conventional medicine doctors as patients, and I have even more as colleagues. And it's like, it's a hard transition to the assessment piece, because you'd have to change the whole insurance model of it, and you got to fight with insurance companies. So you might be able to find the BIA testing in a conventional medicine doctor if they're interested in weight loss programs, but it doesn't really, unfortunately, it doesn't resonate in standard practice, because it isn't. And so it really is hard, because I'm not going to spend 5 minutes on a billable visit going through all this tests. That's not enough time. So different models. Again, it doesn't mean it replaces conventional medicine. It is health testing, and it's something that you should put towards conventional medicine. So you can make your conventional doctor's job easier by saying, okay, well, I don't need to prescribe that medication anymore. Okay, you're working on this kind of stuff, because they're just not equipped with enough time to be able to do all the testing and to be able to give you some of that information that would value their practice as well.
Yep, and we have another question that's kind of right in the same vein, which is, after a patient has gone through treatment, will you test again to see that things have changed, or how the body?
Not all of it, not all of it, because oftentimes, I mean, the whole reason why you get it done once a year, it's like, do you take your car in and do the whole thing again? No, usually see, okay, my tires are running low on tread, I fix my tires, they align them, and then off you go. But once a year, you still want to do the whole test, because you go top down and see, what did I do in that 364 days, especially this last 364 days. That would be interesting, with inactivity and people doing things and stress. So we throw that year's data out. But I mean, the most important thing is you show up once a year and you get things to work on. And it's not like for physicians, a lot of times it's for yourself, so that you kind of know. You have to be your own health advocate, especially again, as you get a little older. You have to be your own health advocate to know these are parts I need to work on, because medicine, alternative and conventional, can take you in just every different direction. It is exhausting at times when I look at patients' treatment plans and we're scratching our heads saying, why are you doing all this? Like, I'm not understanding it. So the more you learn about your individualization and how your body responds, the more you can tell. That means you can go to restaurants, say, I don't like tomatoes, and then you actually don't like tomatoes. Like, it's just, the more information you understand about yourself, I mean, the more tailored your health goals become, and the less time and effort you need to spend on yourself, because you really know the importance of what you need to do instead of trying to do it all.
Well, since you mentioned tomatoes, that's my perfect opening to ask you. Someone wrote in asking, what about the gut microbiome? Are there any tests that specifically kind of dive deeper on that?
Yeah, so I showed you folks testing that's in-house in the clinic, testing that you can show up for, and non-invasive, boom, 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 millions of more bits of information than you would have. We can combine that then with out of clinic testing, such as stool tests, which are really good, such as food sensitivity tests, which are really good, such as urine hormone tests that are very good, such as micro testing. The thing is, that testing takes weeks to get back. So normally we'll do the first assessment, unless somebody says, I want to come to Scottsdale, or I want to come to Providence, and I want to have all of my stuff tested, which again might be $2,500. I want to have my gut tested, my food sensitivities, my hormones tested. Then I combine them with the in-house testing, and I pretty much have a roadmap of everything that I want to do. For some people, they say, let's go ahead and look and see the in-house testing first. Then if I can see my digestive tract is really interesting, then I'll want to go with the food sensitivity testing. So it just depends. For people that are local, we usually will start with the top-down assessments, and then we'll work our ways into specialization after that. But some people just want to have everything up front, which again, some people like to save time by saying, I want to go through all of this so I can see what my next marching orders are, and off we go.
All right, I got a bunch of questions, so I'm gonna kind of rapid fire here a little bit.
Sure.
Any specific tests for molds?
Yeah, mycotoxin testing for sure. I mean,
Okay.
And again, lymphatic testing to see how you handle molds. Molds aren't the problem if your immune system and your lymphatic system can process it. Nothing's a problem with that.
And is the one you just mentioned one that you guys do in-house, or is that one you can?
Absolutely, yeah.
Okay.
Pretty easy.
Another question: if someone were to visit or want to visit for any reason both centers, ACBM in Arizona and the BioMed Center in Providence, are they able to share data, or is there?
Oh, 1,000,000%. Yeah, that's the whole reason they're set up. Yeah, people, you go to Providence in the summer and you come to Arizona in the wintertime. But yeah, there's a lot of transition of care. I made sure I set them up. So, I mean, they have the same systems. There's a lot of sharing of information between the two.
Okay, another question about thyroid tests. I've got someone asking whether or how you feel about T3 uptake or thyroid binding globulin, thyroid peroxidase, and thyroglobulin antibody tests.
Can you repeat the question, Kate? No, just kidding.
Yeah.
I'm not going to make you say that again.
I can
want to see you stumble. I really like when I do thyroid testing, I like to see all those markers, which again, thyroid testing is not TSHs. TSHs is pituitary testing. Thyroid testing ends up being what is the thyroid producing and what's inhibiting the thyroid from being able to produce it. So again, that's all blood work. That's pretty simple and easy to do. And I really like looking at all that because the thyroid's like your wood burning stove. So I want to have as much information as I can about that.
Great. All right, we'll keep going. I'm going to shift gears a little bit, wider of a scope, more about biological medicine and therapies. Question about how to get rid of heavy metals.
Delicately. So you first of all have to make sure that you have a lymphatic system to get rid of heavy metals, because a lot of times, when you have to remember, this isn't like a gluten fast. Like these are things that we require re-exposure to eliminate them. So chelation therapies, you can do IV therapies. Sometimes the lymphatic system can't do that, so you have to do a whole bunch of sauna therapy first, or lymphatic drainage therapies, so that we can clear the highway before we put these heavy metals on. In Chinese medicine, I remember when I was in school, they were always like, don't shake the tiger's tail when their cage door is still closed. And that's their way to say, don't provoke it. It's not just a matter of like trying to get it out. It's a matter of like you're re-exposing your nervous system, and you're re-exposing all your systems to it. And they've been in there for a long period of time. So it's elegantly clay baths I really like. Like there's things called LL magnetic baths, which you can do at home. Those are, the little things that are global treatments really do the best for elimination. Oftentimes when we're doing aggressive things, it's always in my clinic environment where we're doing lymphatic detoxification. We're making sure that nervous system has lots of charge in it, because we want to have the most successful elimination possible.
Very good. All right, I've got another question about stem cell treatments versus surgery for challenged knees. Any thoughts on how biological medicine might approach this?
So I love this range of questions. It's a fantastic audience at taking it through. So I love stem cells. You got to remember, you have to have some cartilage to be able to do any of this kind of stuff. I like exosome treatments, which again, I've seen a lot of great stuff with stem cells and exosomes. I'm not opposed to surgery. I work with a bunch of professional athletes, and I've seen a lot of professional athletes down the road. And sometimes it's better to replace a part, such as a knee, than go ahead and deal with chronic inflammation for the rest of your life while you're spending thousands of dollars doing some stem cell treatment. So it really is like you have to set the organ or the environment or the joint up to respond to therapy, and you have to make sure that the therapy is right. But we've seen incredible results with, we call them regenerative injection therapy, which is stem cells and exosome therapy. But you combine those with things like low-level laser therapy and pulsed electromagnetic therapies, and you can get a really fantastic result from that.
Excellent. All right, and I've got a mother who wrote in and asked about, have you worked in the past with any patients suffering with ALS? And, again, what might you advise that individual to do?
Yeah, ALS is really, that's one of the ones that is like I said, nervous systems are never supposed to be irritated. Nervous systems are supposed to have blood-brain barriers on them, which can just go ahead and take a beating in we'll say, primitive times. Now, man-made chemicals have a big problem because they can get across blood-brain barriers. I always like, you have to rush with ALS because you have to stabilize ALS. I think you should explore doing long-term hyperbaric treatments. I think I've seen a lot of good resolutions with that. Again, pulse electromagnetic field therapy, I've seen lots of like stabilization with that, and definitely exosome therapy, because you have to find things that cross a blood-brain barrier. That's one of those which, you got to roll up your sleeves a little bit with that, because time is of the essence.
All right, speaking about, an incident that's kind of, time is a serious factor here. I've got one individual who asked, speaking about her daughter who has a tumor on the head and who does not do well with anesthesia and is terrified of the procedure. Is there anything that family might consider moving forward as they look to resolve that?
I mean, anesthesia, the hardest thing is, you want to make the job as easy for the practitioner as possible. So I always get these questions because I have a big pediatric practice. And to calm down the person's nervous system before you do anesthesia, or you're always going to want to have the person the most still and quiet and the least stressed to do the procedure. And sometimes, again, that's where conventional medicine can shine. I've seen myself, I'll tell you a terrible story. When I was, and it's not a terrible tumor story about myself, so I'm not even in the same neighborhood as that family as far as severity and concern, but when I was going through naturopathic medical school a million years ago, I said, time to get my wisdom teeth out. I was running out of insurance. This is in Canada. I was on my mom's insurance. I had impacted wisdom teeth, and they said, I'm going to pull them out. And I was in naturopathic medical school, and I said, oh, no, you're not giving me general anesthesia. I'm not going to have all these chemicals in my body. So I said, I'm only going to let you do procaine and local anesthesia. And that was probably the most stressful, worst experience of my life. My dentist, who was a biological dentist, was like, you sure you want to do this? And I said, absolutely. And I bring that story up because the best treatment is the shortest one with the best result. And so sometimes it's like, just do the treatment and do it with anesthesia, because it'll make it so much more successful and allow the procedure to be as quick and as painless as possible.
All right. 2 last questions. I'm aware of time. I know we're coming down to the wire, but I pretty much covered them all. And so one was someone speaking about their use of an ionic foot bath. Is it possible, if you're using this frequently, to throw off pH and hormone levels?
1,000,000%. Yeah, because depending on, I mean, you're causing a detoxification. Plus, I mean, we use a little bit of different foot baths. We use some different foot baths, which mainly are battery charges. But when you're using ionic foot baths, I don't really care what the color of the water is doing, because there's a lot of misinformation about that. But you are affecting electrolytes, and you're causing a huge flux in the system all the time. And so you want to be careful about that, because again, if you don't know if you have hormones to deal with this, namely anti-inflammatory hormones, because anytime you put your body under a detoxification process, if you don't have adrenal hormone or thyroid hormone, you're just going to re-intoxify yourself. And so you have to really know what you're doing. Too much not knowing what you're doing is actually worse than just leaving it alone. Like I said, don't pull the tiger's tail when the cage door is closed. Leave it alone.
Good. All right, last question, and then we'll wind down here. But I've got several people who have asked whether you do Zoom consultations.
Just like we're doing right now. Yeah, like I said, the last 364 days, I've done nothing but Zoom consultations. No, I do lots of that because I have patients all over the world. So I'm very accustomed to having my computer in my back pocket. We have processes in place set up. So you call the front desk, they make it seamless. We get your health information. Again, we have computer systems that can make this very easy. You forward in your blood work from your local practitioner or anything that we need to. And again, I've done that for several years before it was cool. Sending test kits over to Europe, getting test kits back. I mean, industry has made it much more simple to gather your health information. And again, I work with lots of local practitioners so that we can build your local health team as well. I don't have an ego. So, I mean, the easier it is to find local things, the better it is, because we don't want to be stressed about not knowing how we're going to have lymphatic massage. And I'm not the best at it. So I'm sure there's somebody locally that we can work with that's going to be excellent for you to help fix some of the holes in the bucket that you might have in your health.
Awesome. And don't call me, because I do not manage Dr.
Drobot's schedule. Sure number.
But yeah, no, just to be clear, if you are looking to get in touch with Dr. Drobot or Dr. Tom, who's frequently a guest with us as well, you're going to call the BioMed Center New England in Providence, or you're going to call ACBM out in Arizona. And those are the people to speak with to get connected with, biological medicine practitioners, or these two more specifically. Before we close out, I just want to mention that in May, we will be featuring Dr. Sylvia Zanis and her colleague Amber White from BioMed Center New England, all about dental, biological medicine in specific dentistry. So we hope you'll join us for that. And I just want to close by thanking Dr. Drobot for your time this afternoon. So thank you.
And I will say, you don't have to have, this is the whole reason you do assessment testing, is you do not have to have a dental problem to understand how your teeth might be important to your physical problem. So those two, I do a great job. can be just like metals in the body. If we have things that we cannot get rid of, they can affect health downstream. So tune in for that one.